From the perspective of a physician who evaluates these children, aside from the extended age range, if a physician were to look at this and say, this is a lot of information, what do I really need to know about it, and is it going to substantively change what I've been told to do in the past?
Yeah, and that was why we developed the process of care algorithm, because that takes the clinician step by step through what things are required in the process and the sequence that they're doing it. And there is a section within the process of care algorithm, as well as in the guidelines that the Task Force on Mental Health did, of what things would be helpful to change in the practice to prepare for doing it. Primary care clinicians have the advantage of knowing the patients better than if when you refer them to a new subspecialist who's never met them before, which gives them some advantage and cuts down on some of the time of things that, for instance, when I see a patient come to me, it's usually a new patient, to do as part of the time. We also have suggestions like you don't necessarily have to do it all in one visit. You can do it because one of the other big issues that are a concern for primary care physicians is getting adequate reimbursement for the process or not. Working with the school systems that most of their kids come from, so that there is a process where they're getting information from the teachers in a form that helps them make the diagnosis. And more importantly, what we're also emphasizing, that they communicate back to the teachers, and the teacher is part of the team as much as the children and their parents are part of the team as well. So we go into the nitty-gritty in the process of care algorithm, and we separated that from the guidelines, because the guidelines we wanted to be on as strict evidence base as we could have, as that it's good evidence. When you get down to the day-to-day clinical operation, you can't just use that. There are a lot of areas where it's more based on consensus or weaker evidence. And so, in fact, we warn the clinicians in reading through the process of care algorithm that there's going to be a lot of things that are not necessarily at the same level of evidence. And we were careful with the wording, so if you read the guidelines, there are a lot of shoulds in that. You should do this for the guideline, where in the process of care algorithm, there's a lot of you may want to use this or you can use this because we don't have a strong evidence to really push